Hello y'all, this is Set to Achieve. Welcome to another video. And I seem to have been getting like a lot of comments and people saying that they are so inspired and so thankful that I'm putting out videos on nursing, registered nursing, LPN or LVN, and just talking about the things that they're going through. And a lot of them are saying that, like, especially like bedside nursing, um, a lot of them are saying that like they're going through a lot. And if you are, a nurse that happens to love nursing, this video is not for you, because there are people, leaving comments saying, don't discourage people, that are in nursing school. And that I wish somebody would have been out here telling it like it is. Okay. So, I'm just gonna talk about like nursing and drug addiction, okay, or addictive behaviors in nursing, okay. I'm gonna phrase the title the best way that I see fit. But let's talk about this, okay? So I'm reading an article from newdirectionsforwomen.org, okay? And it says like / the rise of substance abuse among nurses, okay? The rise, okay? So let's talk about this, all right? It says here, so the article says how common is substance abuse among nurses? Okay, so it says that less than 1% of employed nurses were working with a known substance abuse problem, and less than 1% of RNs were in active substance abuse treatment programs or ADT programs. Okay, now it says it doesn't seem to be a big problem, right? Or does it? Now keep in mind, okay, that based on reported cases, now these are cases that were documented, that I said, is there evidence for suspected or unreported cases? Okay, so now are there nurses that are actually, addicted to drugs or alcohol that are not reported? Absolutely. Yes, they are. So now the American Nurses Association has indicated that up to 10% of RNs may be dependent on drugs or alcohol. 10%. However, the most worrisome statistics, sorry, that's a tongue tire for me, suggests that between 14 and 20% of all RNs in the US may have a problem with drug or alcohol dependence or abuse. Okay, so this speaks to the unsuspected, all right? So it says that this speaks to the suspected prevalence of unreported cases. So what they're saying is that, so what is actually out there is just the reported stuff. What they're suspecting, and this is according to the American Nurses Association, is that even more are addicted. Okay, so it says it's suspected. Now this is what they suspect. Okay, now this is not me talking. Okay, this is the American Nurses Association, that 1 of every 5 or 7 to 7 RNs is affected by an addictive disorder. Okay, I'm gonna just stop there. 1 out of 5, maybe to 7. Okay, so that's like 14 to 20% of RNs, nurses, are like drug addicts or alcoholics. So that is a suspected case. Now, what is out there is what is out there or what is documented is less, but according to the American Nursing Association, there's more that are addicted. Now, I'm gonna put my own scenario. I'm not giving anybody any excuse. And if anybody, is watching this video, maybe they're a nurse, or maybe they're trying to be a nurse, or they know a nurse that is addicted, they need to seek help or treatment, okay? But I'm gonna tell you based on my experience, okay? So my background is I became a registered nurse in 2010, worked it for some time. As a matter of fact, I was already burnt out like within the first 6 months, okay? Would go back home and cry, and just be really depressed, and I was working in bedside nursing. Now I'm going to do a video talking about the fact that bedside nursing is not for the weak, because it's not. But nursing in itself is very overwhelming. Okay. I see nursing as nurses as the most underappreciated and stressed, one of the most underappreciated and stressed professions in the world, hands down. And I can tie the fact that that is the case to the addiction. I can certainly I can tie it, like, because it's not like physical stress per se, is the mental stress. Okay, the mental stress. The thing is this: when the doctor drops the ball, it's the nurse's fault. When the what do you call it, physical therapists or occupational therapists, all the people that come in there, when they drop the ball, hey, who admitted the physical therapist? Because the nurse, especially the registered nurse, is the one that admits the physical therapist. Remember when I was in nursing, I would admit the physical therapist. I would decide how long that the patient needed to, how long the patient would need to be seen by that physical therapist based on their condition or whatever the case may be. So the nurse is the one that admits the physical therapist or decide, oh, they might need therapy. Oh, no, they don't need therapy. Okay. Now, when I was working in a skilled care facility, it's one of the days, like basically like a usual every day. There was like so much going on. The doctor called that this patient has been admitted, blah blah blah. They're coming from this facility, blah blah blah. So you're writing out all these different things, and then something happened. The CNA was asking for the shower sheet, and blah, blah, blah. It was like a whole lot going on, just like in circles. And I was like, oh my goodness, this is a lot, But that's what I was used to, right? So the physical therapist came in, and she was like standing on the corner, and she was kind of like waiting for everything to kind of settle down. And she told me, like, oh my gosh, you guys are like heroes. I could never do this. Like my job is a lot calmer than, she's like, oh my God. She's like, just watching you and watching like everything going on. Whew, I'm thankful that I became a therapist. And then she wanted me to sign something, that she came for, whatever. And then she left. Now, I'm just saying this to say that, I'm not excusing what is happening, but I can believe that the statistics that I'm seeing, or the reports are true. Okay? Because when I used to work at the one of the facilities that I would work at, especially when I became a nurse, I was like overwhelmed and surprised because everybody was always running for smoke. The CNAs, the nurses, it was like, okay, not even for food. They weren't trying to get like food, like, oh, okay, it's my break time, I'm hungry. No, they were looking for a smoke break, So I can imagine if they were like, whew, it was crazy. Okay, so, and me not being a smoker, it was like, what is going on? Why are these people like this? Until I started, spending some more time and realizing that that's why, because it's a lot going on, Something happens with the doctor, the nurse is to blame. Something happens with the patient, the family blames the nurse. If the CNAs are not doing their work, the nurses are to blame. So it's a lot, it's a lot. And, one has to really factor in a lot of things, the stress of the job is a lot, okay? And then a lot of the facilities are not helping, because they're always short-staffed because nobody wants to come into a hellhole. Nobody wants to come in, so you're going to be short-staffed, You're always going to be hiring, because people are going to be running away, right? So it's a lot, and it's very sad because, obviously, if these nurses are addicted, they're not all there, and who suffers? The patient, So one has to, one has to keep, a lot of things in mind. I think there has to be some kind of program or some kind of like stress relief um programs put in place in like facilities, especially skilled care facilities for nurses, because I mean, just looking at what is being reported, um, yeah, it's a lot, So I left nursing right before COVID hit. My mental health was going down, and I strongly believe that if I had stayed in nursing, I probably would have been, one of the ones that were addicted to alcohol, or, or something, or some kind of substance, because it's like there's no outlet. There's no outlet. None, you know? There's no outlet, If you're telling your family members that you are suffering, in your facilities, and they're like, well, you're a nurse, like nobody understands and nobody wants to care, because like, for example, when I was suffering and going through a lot in nursing, my ex, who happened to be a narcissist, refused to understand, he refused to understand because it was like he was benefiting financially, from me, so basically I was the supply. So it didn't matter what I was going through. It doesn't matter if I was dying. It doesn't matter if I was losing my mind. It didn't matter if I was going gray prematurely. It didn't matter because, after all, you're bringing the money home. So one thing that needs to be said, because people don't say, nobody told me, because I wish there were more videos like this when I was coming up, when I was in nursing school, because I was just thinking that like I would come out of nursing school after all the stress and the pain and the anxiety, and it would just be like happy-go-lucky forever. Nobody told me. Nobody tells you anything. Nobody tells you anything, And most of the nurses just suffer in silence, because if nursing was so great, why would there be such a high percentage of addicted nurses, especially RNs? Why? And it's, with all these things going on, we know that yeah, because of the stress, and everything, there's going to be more medication errors, and so much more malpractice, and it's just going to go on and on, and I mean, we can blame the nurses all we want, but like, I was thinking about it, like, okay, when I was working in a skilled care facility, there would only be one nurse in a night, and this is about 60 patients, about 30 on each side, side A, side B. One nurse, and I would be the only nurse passing out medications, delegating to the CNAs, doing this, doing that. God forbid there was some kind of incident, like a fall. You would not leave maybe 3-4 hours. You would still be there documenting, having to call the doctor. Of course, the documentation would be way after. Having to call the doctor, having to alert the family, having to do this, having to do that. And yeah, I just knew that nursing was not for me. I know people say, well, there's insurance nursing. There's, you can be an admin, you can do this and you can do that. Nursing is not, I don't care what the field or whatever is. It's not for everybody. It was after I left nursing and recollected myself to the glory of God and Christ. I give God the glory, for giving me the sense and the even though everybody around me was telling me that I was stupid, I was dumb. How could I leave nursing? It was a noble profession and everything. I said to myself, even if I'm making 1/10, 1/20, 1 out of 20, or 20% of what I'm currently making now, right? If I could have peace of mind and start like putting myself together and finding something different, I went back to braiding. I went back to doing braids because that's what God told me. Go back and go back to what you were doing before. I learned braiding when I was 12. Still, I would self-teach myself. I would part my hair in sections and just start twisting and doing things. I would buy extensions or have my parents buy me extensions. I would ask for the color that I wanted, and I would just start doing my hair. At first it was rough, but as time went on, it got better and better. And then my sister started admiring my hair, and she was like, you gotta hook me up. You gotta do my hair. And I mean, and from there I started doing delivery, and it kept going from there, you know, and I started building. I never went back to nursing, to the glory of God, because I'm pretty sure that I probably would have been one of the undocumented cases, you know, and that's putting people's life at risk, you know. But it's like the whole healthcare system is to blame, you know. That's why, because who are they going to complain to? If you complain to management, it's going to be a problem. They're going to start keeping an eye on you, or trying to fault find the things that you do, or sabotage you. Who are you going to complain to? You complain to your family, they're going to be like, oh, suck it up. After all, you're making money. Who do you complain to? You know, so there has to be like a serious look on the whole system, the whole healthcare system, because I don't believe that, you know, the addiction and, you know, is the right path to take, or, you know, obviously, you know. And and that's why I say, if you find that you're burnt out, if you find that you're second guessing why you're a nurse in the first place, you need to leave. You need to leave. Okay? You need to leave. You know, some people are just going for nursing because they say that, well, they make money. But do you know what else is in it? You're dealing with lives, you know? So, and when you're dealing with such a profession that requires so much, and a lot of the work environments are very toxic, you know, very catty. Everybody's trying to blame people, everybody, and it's just like the nurses are not even helping each other, because it's like, you know, everybody's just trying to make sure that nobody's blaming them, and it's just like a vicious cycle, you know. So a lot of the nurses, especially RNs, you know, I still have my license. I mean, I still renew it or whatever, just to keep it active, but I would never, oh God. Yeah, I could never go back. Somebody said never say never, but, you know, I'm somebody that is led by the Holy Spirit. And I know that the only reason why I went for nursing in the first place was because a lot of my family members are in healthcare, and it was just a thing to do. But yeah, a lot of issues need to be addressed, you know, yeah, a lot needs to be addressed, you know, from the nurses to a lot of the facilities. They put a lot on the nurses. It makes no sense, you know. And then when there's an error that happens because these people are overwhelmed and overstressed, they're gonna say, oh, there they go, you know. The facilities are quick to throw the nurses under the bus, you know. And I feel like if it continues that way, a lot less people are gonna be nurses, you know, when they see the writing on the wall that these people don't care about me, you know. They don't care about me, you know. And so yeah, I just wanted to put out this video because, yeah, I'm getting like comments of people that are saying like, wow, I'm going through a lot, I want to leave nursing, you know, I'm an RN, I'm an LPN, you know, and just even CNAs or nursing aides leaving comments saying that they've been in healthcare for a long time, and that like just watching everything that has gone on like for years, like some saying like, wow, they can never be a nurse, or there's just a lot going on. It's just a lot, you know. But I know that there are many things that need to be addressed. There are many things that, because when we're talking about like positive patient outcomes, you know, everybody is at everybody is at fault. You know, if you're talking about, you know, why are this happened, why there's so many nurses. I mean, 1 out of 5 is a lot. You know, addicted. You know, oh yeah, yeah. There's a lot going on. You know, why are they drinking so much? Why are they on drugs? You know, that begs a question. But again, this is set to achieve. You know, like the video, leave your comments, subscribe to the channel if you're new. I'm gonna try to keep the videos coming because I'm getting more comments. You know, leave your comments if you're a nurse, maybe you're a CNA, maybe you're LPN, maybe you know, whatever your situation is, or you know, if you vibe with my content. And yeah, like the video to share to more people. You know, hey, you never know. But till next time, God bless. Peace.